one thing that I, have seen in the salon is eczema. The clients will have eczema on their faces and whatnot, and I can see where that has migrated to their scalp.
Absolutely. So another common cause is kind of eczema or psoriasis. So really, when there's true inflammation in the skin, remember, scalp is still skin. So any place where you can flare on the skin, you can also flare on the scalp. So a lot of patients may have just more patchy and focal areas where they're having some dryness of the skin. It can look very similar to the naked eye, but to a dermatologist, they can kind of pinpoint some differences, or using specialized scopes to really understand, look at blood vessels or see other characteristics on the scalp to point them in direction of eczema or psoriasis. But with those two particular type of conditions, they can kind of be persistent and be a little stubborn to go away on their own at times, and stress can flare them definitely. Also, diet can flare them. So I always have people, we go through product changes, but sometimes they may need some topical treatments, but we also go through their diets just to make sure we're kind of doing an inside-out method of treatment.
That is excellent. That is excellent. Because diet plays a major part. Again, you're treating these things from the inside out.
Right.
And that's what I tell most of my clients. And so when it comes, now what would be the difference? Can you tell the difference? Well, can a hair care specialist, a hairstylist, tell the difference between psoriasis or eczema?
It can be a little difficult at times. In my course, we kind of break down and go through psoriasis, seborrheic dermatitis, eczema, and kind of what you can recognize on the trichoscope that you use. But in general, psoriasis typically is a little bit thicker. If it's scratched or if you remove some of the scale, it may bleed a little bit, whereas eczema shouldn't have that. But sometimes if someo's really going to town and scratching, they have very beautiful nails that are very well manicured, that can actually cause some breakage in the skin and bleeding as well. So if it's not very manipulated, you may be able to distinguish a difference. Usually also plaque psoriasis is a thicker white silvery scale that flakes off fairly easily.
Okay, so let me just say this for my viewers: don't be in the mirror, assessing your scalp. No, let's not do that. Definitely you want to seek the advice of your professional, be it the hair care provider, or a dermatologist, which is our specialist.